For my project, I'm going to be talking about breast cancer in both the United States and Belgium. Breast cancer is a disease in which cells in the breast begin to grow out of control. Most breast cancers begin in the ducts or lobules. It can be spread outside the breast through blood vessels and lymph vessels. Studies have shown that your risk for breast cancer is due to a combination of different factors. Doctors often use additional tests to find or diagnose breast cancer. These doctors may do a breast ultrasound, diagnostic mammogram, MRIs, or a biopsy. Breast cancer can be treated in several ways depending on the kind of breast cancer and how far it has spread. Treatment options include surgery, chemotherapy, hormonal therapy, biological therapy, and radiation therapy. Unfortunately, there are factors in which people cannot control whether they get breast cancer or not. The risk for breast cancer increases with age. Most breast cancers are diagnosed after the age of 50. Another factor that cannot be controlled is inherited mutations to certain genes, such as the BRCA1 and BRCA2 gene. Women who have inherited these genetic changes are at a higher risk of breast cancer. Women who have had breast cancer previously are more likely to get breast cancer a second time. A woman's risk is also higher if she's had a mother, sister, or daughter with breast cancer. Having a first-degree male relative also raises a woman's risk. Women who have had radiation therapy to the chest or breast before age 30 have a higher risk. The drug DES was given to some pregnant women in the U.S. between 1940 and 1971 to prevent miscarriage. Women who have had taken this, or if their mothers have taken this drug, they are also at risk. There are also factors that women can control. These factors being not physically active, being overweight after menopause, taking hormones, reproductive history, and drinking alcohol can also increase breast cancer risks, as well as smoking, being exposed to cancer causing chemicals, and changes in hormones due to night shift work may also increase breast cancer. Someone who has a strong family history of breast cancer or has inherited their BRCA1 or BRCA2 gene are at the highest risk of developing breast cancer. Breast cancer is the most common cancer diagnosed in women. There has been a significant increase in breast cancer mortality rates over the past 25 years. It is estimated more than 2 million new cases occurred worldwide among women and men. In general, developed countries such as the US, England, and Australia have higher rates than developing countries such as Cambodia, Nepal, and Rwanda. In 2012, breast cancer was the most common cancer type, with 13.8% of all cancer cases. There has been a general increase in breast cancer due to several contributing factors. Population growth was 12.6%, aging population was 16.4%, and 4.1% was because of the age-specific cases. We expect the number of cases to increase over time because the world's population is growing. The more people there are, the more cancers there will be. The population is also living longer. Since age increases the risk of breast cancer, we expect to have more cases over time. The burden of breast cancer is not evenly distributed. There are large variations in incidence, mortality, and survival rates between different countries, regions, and even within specific regions of the country. In America, it is estimated that 30% of all new cancer patients, which is around 252,710 among women, are breast cancer. In North America, the 5-year relative survival rate of breast cancer patients is above 80% due to the timely detection of this disease. The age standardized rate per 100,000 is 84.9, ranking the United States number 22 on the table of age standardized rates. For women under 45, breast cancer is more common in African American women than in white women. In Belgium, breast cancer is the most common cancer in women. Belgium has the highest breast cancer incidence in the European countries. This may be due to the accumulation of risk factors. The relative impact of these factors is unclear because there is not enough statistical studies. Breast cancer is responsible for 3% of all-cause mortality in Belgian women. On the age standardized scale, they rate 113.2 as compared to the United States, which is 84.9. Belgium is ranked number 1 on this scale. The rate of diagnosis is higher than any other country, but as experts explain, that is not necessarily a sign Belgium is doing something wrong. The age standardized rates are used in tables. Belgium is ranked first, while the United States is ranked 22nd. This is a summary measure of the rate of disease that a population would have if its standard age structure. Standardization is necessary when comparing populations that differ with respect to age, because age has a powerful influence on the risk of dying from cancer. Belgium has the highest rate of breast cancer in women. It is commonly known that breast cancer affects more women than men worldwide. The biggest reasons are because women's breast development takes 3 to 4 years. It is uncommon for men's breasts to fully form. Most of men's breasts you see are fats, not formed glands. Another reason is because breast cells are very immature and highly active until a woman's first full-term pregnancy. While still immature, breast cells are responsive to estrogen and other hormones. Lastly, men's breast cells are inactive, and most men have extremely low levels of estrogen. Due to the infrequency, much less is known about male breast cancer than female breast cancer. The American Cancer Society recommendations for early detection of breast cancer vary depending on a woman's age and the woman's level of risk. Mammograms are a low-dose X-ray produced that allows visualization of the internal structure of the breast. For women at average risk age of breast cancer, the American Cancer Society recommends that those 40 to 44 years of age have the option to begin annual mammograms. Those 45 to 54 should undergo annual mammograms, and those 55 years old and older can go biannually or stick to going annually. MRIs are recommended annually for women at an increased risk for breast cancer. ACS recommended annual MRI screening in addition to a mammogram for women at high risk. MRI uses magnetic fields instead of X-rays to produce a very detailed cross-sectional image of the body. MRI should supplement but not replace mammogram screenings. Breast ultrasounds are sometimes used to elevate abnormal findings from a mammogram or physical exam. Studies have shown that ultrasound detects more cancer than mammograms alone when screening women with dense breast tissue. Clinical breast examinations are no longer recommended based on the lack of clear benefit. Clinical breast examinations plus mammograms have shown to detect only a small portion of breast cancers. Treatment decisions are made jointly by the patient and the physician after consideration of the stage, biological characteristics of the cancer, the patient's age, menopausal status, and references, as well as the risk and the benefits of the treatment. The primary goals of breast cancer surgery are to remove the cancer and determine its stage. surgical treatment involves breast conserving surgery or a mastectomy. To optimize participation in surgical care, a system of referrals should be developed. Financial, social, and psychological barriers to breast cancer surgery should be minimized, and women should be empowered in making these decisions. Radiation therapy is the use of high energy beams of particles to kill cancer cells and is often used after surgery to destroy any remaining cancer cells. The method depends on the type, stage, and location of the tumor, as well as patient characteristics and the doctor and patient preference. Systematic therapy is a therapy that travels through the bloodstream and affects and treats almost all parts of the body. Systematic therapy includes chemotherapy, hormone therapy, and targeted therapy, all of which work through different mechanisms. Chemotherapy drugs generally work by attacking cells that grow quickly, such as cancer cells and hair cells. Hormone therapy works by either blocking the body's natural hormones or lowering the levels, which can act to promote the growth of some cancers. Targeted drugs work by attacking specific molecules in or on cells that may be more common or active in cancer cells. As an organization of nearly 2 million strong, the American Cancer Society is committed to a world free from the pain and suffering of breast cancer. There are 8 outstanding programs for breast cancer patients. The ACS does everything in their power to help prevent breast cancer by promoting healthy lifestyles, by issuing cancer guidelines for prevention and early detection, helping people avoid tobacco, and reducing barriers to healthy eating and exercise. Information is available online or through a hotline that connects you with a caring, trained staff member. Navigating the healthcare system can be overwhelming, especially those who are medically underserved, those who have experienced language or health literacy barriers. The Patient Navigator program helps with these barriers. The Reach to Recovery program allows patients to be paired with a trained volunteer to help them with this journey. The Cancer Survivors Network provides a safe online connection between patients who have had a similar experience or interest. The Road to Recovery program offers cancer patients free transportation to and from their cancer-related treatment. The Hope Lodge provides a free home away from home for cancer patients and their caregivers. It is a nurturing community where patients can share stories and offer emotional support to one another. The Look Good, Feel Good program teaches women how to cope with appearance-related side effects of cancer. Skincare, makeup, and hair loss solutions and techniques and tips are provided. Another program to help patients is the Tender Loving Care publication that offers affordable hair loss and mastectomy products. Lastly, the Life After Treatment Guide may help cancer survivors as they begin the next phase of their lives. An important part of ACS is their research. They invest more in breast cancer research than any other type of cancer. Their funded research has led to the development of potentially life-saving breast cancer drugs, as well as improving the understanding of genes linked to breast cancer. They are currently funding $59 million in breast cancer research through 159 research and training grants. The Belgian Foundation Against Cancer is the only national organization who fights cancer in Belgium. They receive donations and legacies, corporate proceeds from events or campaigns, such as Together Against Cancer. The raised funds are divided into 3 equal parts for different purposes. One is support for medical research. The second is health information campaigns and prevention. And the third is to assist patients and their relatives. The American Cancer Society and the Belgian Foundation Against Cancer are very similar organizations developed to fight cancer. The foundation has large funds to finance scientific cancer research, again, similar to ACS. The foundation also assigns a large amount of money in its budget to inform the public about risk factors. The foundation believes that the fight against cancer is easier to fight when people are made conscious at a young age. All the information is accessible at their website. The Belgian Foundation Against Cancer also gives assistance to patients and their relatives through multiple services, such as transportation, psychological aid, help with beauty specialists, financial and administrative support, and a free help line. There are also regional supervisors that coordinate the work of many devoted and trained volunteers who ensure the local activities of the foundation. All of their programs are extremely similar to the American Cancer Society. With any health condition, there are ethical considerations every healthcare professional needs to understand. Genuine informed consent involves discussions of all relevant medical issues with the patient so that she or he understands the ramifications of the diagnosis, treatment, risks, and benefits of undergoing or refusing treatment. It also enables the patient to make a reasoned decision. The emotional minefields of a cancer diagnosis in a young woman can amplify conflicts between a physician's recommendation and patient's wishes. Evidence-based medicine and adherence to ethical principles provide guidance for navigating these difficult situations. National foundations around the world have been spreading awareness, educating, treating, and caring for women and men that have suffered from breast cancer around the world. As breast cancer is ranked as one of the most common types of cancer worldwide, national foundations strive to put breast cancer education, awareness, treatment, and care at the forefront of the World Health agenda. 2 million people every year are being diagnosed with breast cancer. When national cancer foundations spread awareness about the risk factors, it helps the world's population become more conscious about this issue. Researchers around the world are working to find better ways to prevent, detect, and treat breast cancer, and to improve the quality of life of patients and survivors. Studies continue to uncover lifestyle factors and habits, as well as inherited genes that affect breast cancer risks. A few examples of studies are looking at the effect of exercise on breast cancer, weight gain or loss, and diet. Studies on the best use of genetic testing for breast cancer mutations continue. Studies are exploring how common gene variations may affect breast cancer risk, and possible environment causes of breast cancer have also received more attention in recent years. These research studies are a way in which breast cancer information is being spread worldwide. This type of research takes many years. It might be some time before meaningful results are available for the world.